Next article I looked at was called Exploring the Effectiveness of Emotionally Focused Therapy for Depressive Symptoms and Relationship Distress Among Couples in Taiwan, a Single-Arm Pragmatic Trial. Yeah, it's a long title. So this was the first study to explore effectiveness of EFCT, that's EFT for couples, for depressive symptoms and relationship distress. The first one in Taiwan. They utilized 17 couples, which they called a low dose of only 7 EFT sessions. They were looking to see if they were to be able to change the depressive symptoms, if that would have an effect on the distress in the relationship. To do this, they used a single-arm pragmatic trial study, and another way to get people was that vouchers were given to them for every 3 sessions that were completed. They used 2 different measurement scales, a dyadic adjustment scale, the DAS, to measure the relationship distress, and a patient health questionnaire 9, known as a PHQ-9, to measure depression. For the treatment outcomes in this study, the positives that were taken away were that there was a decrease in the depressive symptoms. However, for negatives, there was no significant change in the relationship distress, and only 41% of the couples actually completed the treatment, while 29% of them actually dropped out completely. The relevance for this is that the different levels of depression and distress can cause some to struggle with the EFT process. The consensus I came to with this was that it is effective for reduction of depression, but not necessarily for relationship distress. Sometimes the underlying symptoms may need coping strategies, maybe individual therapy, so one can learn how to cope with that before they're able to fully utilize EFT as well, as shown by many people dropping out in the process. The quality assessment method strengths were that they found a good group of people who identified as having depressive symptoms and relationship distress. However, the weakness was that there was a very small sample size, which, like I said, got even smaller as the study went on due to people dropping out. There was no publication bias that was noted. Another thing I found that I believe is true is the single-arm pragmatic trials are typically used for what is considered normal conditions, but here they actually sought out people that already had depression and distress. They didn't really go for those who naturally would have just come in. They found a group of people that were already experiencing symptoms. My key takeaway from the second article here is that this seemed like a great idea for research, but ultimately it was a big failure due to very few participants completing the treatment. And then also they only used 7 sessions of EFT when it's shown that the minimum is 8. It should be 8 to 20 sessions. And out of that though, you can get success from failure. So it did show that EFT might not be the right modality of therapy for everyone. The next article here was the efficacy of emotionally focused couples therapy and behavioral couples therapy, a meta-analysis. Both behavioral couples therapy and emotionally focused therapy are 2 common treatments for couples in distress, which is why they used it. They used randomized control trials. In this, they actually looked at 33 different studies, which totaled 2,730 different participants that they were able to pull data from. The results showed that both BCT and EFT provided a higher success than no treatment at all or individual psychotherapy alone. Treatment outcomes for this were positively. It showed that these positive effects lasted 6 months to a year even after the treatment was completed. Negatives, there were no negative treatment outcomes that were noted. The relevance here showed that EFT produces positive outcomes in couples therapy, regardless if you use EFT or BCT. And then the consensus here I found was that EFCT was more effective in producing the positive results in the treatment than its counterpart BCT, even though both of them did produce good results. The quality assessment of this research was that the strengths they had in their methods were they utilized 33 studies, like I said, with a total of 2,730 participants that were all involved in measuring the relationship satisfaction that they were trying to look for. However, this did lead to a weakness actually, where some of these participants could have been overlapped in different studies that they used. So in the 33 studies, they might have taken data from other studies as well. So this number could be greatly inflated. Potential for publication bias. This is one where they knew that there was going to be some kind of bias in there. So actually in their abstract, they noted results have to be interpreted with caution due to publication bias. So yes, there is publication bias here, and that is due to the inflated numbers that you see in the results. And again, utilizing so many participants that could have overlapped gave them this very large sample size, which they tried to reduce and account for in an attempt to eliminate the bias, but there was definitely enough there for them to go back in and put it in their abstract that there's going to be bias. The fourth article I took a look at here was called Exploring Associations Among Baseline Emotion Regulation and Change in Relationship Satisfaction Among Couples in a Randomized Controlled Trial of Emotionally Focused Therapy Compared to Usual Care. Usual care being typical, any other kind of care that couples might seek out to assist them with their emotional regulation. They use dyadic multi-level modeling to view the changes in the treatment groups. Difficulties in Emotion Regulation Scale, or DERS, was used to self-report emotional regulation difficulties. There were 28 couples that were used, and it was a very diverse group that was very similar to what you would find on a United States consensus in terms of percentages of populations in our country. There was a large amount of data missing that did cause a lot of validity concerns, and they tried to adjust for it, but it still was kind of too much. Ultimately, it did show that EFT was effective when compared to usual care for emotional regulation reduction. As far as the positive treatment outcomes for this, it was found to help couples and individuals with all levels of emotional regulation. It wasn't just if they had higher levels or lower levels. All levels were actually impacted and had positive results. There were no negatives to note in the outcomes. The relevance here is EFT versus usual couples care were equally effective, and they both showed positive results. So really, the consensus is that any therapy for couples that are in need of emotional regulation is good to get. Therapy is good. As far as the quality assessment of this research, the strengths in their methods were that the diversity that they used for their participants was very strong. It was very well done. Also, in their DERS measurement, they removed the awareness scale, which has been shown in recent research to be invalid, so that was removed prior to doing it. The weaknesses here were that they use many different therapists, which can create a lot of unknown variances. Some potential for publication bias here is that there is a lot of missing data. In fact, it said that there was 42.5% of the data missing, which actually has a term that is called missing not at random, or MNAR, which means that publications may have omitted this on purpose. This really impacts interpretation of this research because with so much data missing, you can't really tell what they put, and did they just publish what they wanted and get rid of all the stuff that could have been a detriment to their research. So on to my fifth article here, which was titled Emotionally Focused Therapy and Treatment as Usual Comparison Groups in Decreasing Depression, a clinical pilot study. So they looked at EFT and how effective it was in reducing depressive symptoms in couples. They took a clinical research approach to the EFT compared to treatment as usual, which they refer to as TAU for distressed couples. They used a CESD to measure depression scores that actually dropped enough to no longer be considered clinically depressed at the end of this study. They were also measuring the therapists themselves with a EFT TFS, which is an emotion-focused therapist fidelity scale, to see how competent the therapists were. Both EFT and TAU were effective in decreasing the depressive symptoms. EFT was actually more clinically significant in reducing the depressive symptoms, and like I said, the mean was shown that they were no longer clinically depressed according to the values. The therapist mean score actually came out below the threshold for competence. It was 37.5 as opposed to 39 being the line for competence. For the treatment outcomes here, the positive showed that there was a significant decrease in the depressive symptoms. The negative treatment outcome, fidelity checks showed that the therapists were not fully competent, like I said. This could cause some problems, obviously. The relevance here is that EFT is proven to be very successful in reducing depressive symptoms, and the consensus would be that TAU and EFT both shown effective in reducing the depressive symptoms, and that, once again, therapy is good. The quality assessment of the research showed strengths in the methods being that they used previous data and then they compared that to their own data so they can get a comparison to provide more accurate and more fulfilled data. One of the weaknesses could have been that Premarital therapy was offered, so this could have brought in people that aren't the norm for people seeking this therapy. And then they only did the very minimum, the 8 sessions of EFT, which they did hit the threshold of what a minimum was, but still, I felt like they could have gone farther. There were no publication biases noted. My interpretation and takeaway from this treatment was that if they had used therapists that were actually really competent, not people that were new, get more trained individuals in there, and then do the full course, it would have gave a lot stronger data for them to stand on. They still got what they were looking for in significant decrease in the depressive symptoms, but it would have looked a lot better had they gone through and had fully qualified people doing a full treatment. So the final article I chose might not have had the meta-analysis kind of data that we were looking for, but I thought it was a really good way to tie this all together in coming to a closing. It was titled, "You Feel They Have a Heart and Are Not Afraid to Show It, Exploring How Clients Experience a Therapeutic Relationship in Emotionally Focused Therapy." This looked into the therapeutic relationships between the client and the therapist of EFT, as the title states. And they did semi-structured qualitative interviews using a hermeneutic phenomenological thematic analysis. I'll be honest, I just wanted to put that in there because there's a really big word that they use, so I thought it needed to go in there. But what that actually means is the approach seeks to interpret and explore lived experiences by systematically investigating people's descriptions of their subjective experience and life words. This is how they explained it in their article. There were 4 main themes that they noticed that clients said were very important to them. Number 1 being forming a trusting relationship or finding it hard to connect was a big impact on their therapy. Number 2 was collaborating and struggling to find new ways to relate to painful feelings was important to them. Number 3 was alliance ruptures and needs further repair when working with distressing emotions. And the last one was the significance of new relational experiences. Here's the table that they published with their article showing that almost everybody, 94.44% of people, said that it was super important to them to form that trust with the client, build that therapeutic relationship between the client and the therapist. Trust is very important when it comes to EFT. Some additional notes I wanted to mention here before I wrap everything up is that most all of the EFT articles that are published are done so by people who already practice EFT and are looking for a way to expand their knowledge and the therapy in general. So the bias can be there, but I don't believe it's any more prevalent than it is in any other articles in the same way. Some other key things that could also hinder EFT that didn't go through, a lot of them said that there were nothing noted for negative outcomes. Well, an inadequate or untrained therapist in EFT can really hinder the EFT process, obviously. Also, if the client has underlying issues that they cannot work through, they might not be able to process through all the stages of EFT like we've seen when somebody dropped out in the depressive one. Client might not also be ready or even know how to figure out their emotions and tap into them in order to allow themselves to become vulnerable like is needed in this process so that they can move forward. And lastly, like every form of treatment, whether it's doctor or psychotherapy, anything, the key is to have something that fits with the person. If emotionally focused therapy isn't something and you know that you're not going to be able to go into those emotions, this might not be right for you. But on the other hand, if you're trying some other form and it's not going well, maybe EFT is a better fit. So my conclusion and recommendation for emotionally focused therapy is this. EFT is a growing treatment that has a number of uses and has been shown in the research to be a very effective form of therapy. I do think that there is more EFT research that needs to be done, although there is an ICEFT website, the ICEFT, which is the International Center for Excellence in Emotionally Focused Therapy. They have plenty of research on there, and I actually avoided a lot of the research because I didn't want to run into publication bias. However, when I went back and I looked at some of the articles, I looked at quite a few of them and I really didn't see publication bias that was anything to be noted. I thought they were pretty legitimate and done very well. This is actually growing so much that UAA just opened a new class, Social Work A690, the Introduction to Emotionally Focused Couple Therapy. So it's now become a part of curriculum in schools as well. And this all leads to me thinking and believing that EFT is something that I would highly recommend for somebody to at least consider becoming a part of and learning if you're going into the field of therapy to become a therapist, or you just want to expand your knowledge on things like this.